So affective disorder, which is a mental illness, and her zeal to create awareness on her condition. It is estimated that 1 in every 10 people in Kenya are victims to a certain mental disorder. The number increases to 1 in every 4 people among patients attending routine outpatient services. However, the limited attention paid to the condition leaves patients relatively isolated, especially when no help seems to be forthcoming. Depression and anxiety disorders are the leading psychological illnesses diagnosed in the country, followed by substance use disorders. We narrow down to schizoaffective disorder, one of the rare cases unheard of in the country. We take a tour to Banana Village in Kenya's Kiambu County. Here we meet Esther Mudhoga. Her smile hides the struggle she faces daily. She is partially deaf, and her mother helps us identify with her story.
When she was a little girl, she used to knock herself, so angry and for nothing, so aggressive. So I didn't understand well. Taking her to school, she didn't know anything. The teacher was her foundation, didn't tell me the problem, so I didn't know anything about her. When she got to class 4, she didn't know even to write her name. So I thought it's dyslexia or something.
The 20-year-old Esther is surviving with schizoaffective disorder, a situation that took her some time to accept and come to terms with the fact that she actually needed help. After an intense journey of back and forth of denial came to an end in 2017.
When it comes to accepting that truly I need help is when I realized that I was affecting those people that truly loved me. And through my behavior, through my character, I became pain instead of a blessing.
She's clearly very happy to have achieved what majority with the condition have not been able to achieve. Being a model, entrepreneur and content creator, she reveals the genesis of her determination to bring awareness on her mental state.
When I became danger to even my family, even to my own biological mother, because they were not understanding what is going around. And that is when I was like, okay, let me become an activist on this. This thing is real. Let me speak about it.
Esther's mother, Rachel Njuguna, is among the ingredients of her inspiration. The love between the two shines through their smiles as they take up chores in the house, despite the relapses she faces occasionally. Raising a child with a mental illness has not been easy on her part, but what has kept her going?
Her little sister let Esther take the place, like the last one. And she couldn't know. I said, Esther, you know what? Go sleep. You're so manic, you're so talking. You know, we realized how she's getting manic, when she's getting out of control. We just managed that. Love and nothing else.
Esther has not been spared from the suicidal vows just as presented in other psychological dysfunctions, but she says her medication together with her doctor have contributed a lot to her betterment. We asked to accompany Esther for a doctor's appointment. She's happy to tag us along, where her psychiatrist Dr. Gerald Ganga brings us up to speed on her condition.
In this one we have like irritability, anger, swinging from being high to low, okay, which is being manic or being depressive, okay. So when you have schizoaffective, it means that you have a combination of the two.
According to the Ministry of Health in Kenya, mental illness accounts for 4% of significant health conditions, and the prevalence is rising. There is, however, a paucity of trained medical professionals to handle mental illnesses. Most health workers in dispensaries, health centers, and level 4 hospitals have limited training in attending to mental disorders, meaning many patients are lost in the referral system before they're able to get help.
We need to employ more mental health specialists, more so in the counties, because you get people coming from as far as Eldoret, Kitale. You go to this other northeastern side, there's practically no one, so they all come here.
Dr. Ganga's parting shot is for Kenyans to break the silence surrounding mental illness through addressing stigma and promoting better understanding of mental health and taking seriously the experiences of children and young people. Esther is also partially deaf, and Njuguna has sent an appeal for well wishes to come to the aid to help raise 3 million shillings to help get Esther for surgery come December. Any amount or information about Esther will be sent to and received through M-Pesa number 0729485753, account name Rachel Kanina Juguna. Given the substantial anticipated burden of mental disorder in the context of COVID-19 pandemic, mental health response should be given a higher priority as Esther thrives to bring awareness on this disorder that has put her life on the edge. Anodida, KUtv, Kiambu County.
I love you, Anne.
Thank you so much, Anodida, for covering such an insightful story. Now we're taking another very short break here at KUtv. In a moment, we shall be coming back with more news.